today's agenda, we will be talking briefly about who are H2A workers, just really briefly, but the bulk of the discussion today will be about healthcare access. We'll talk a little bit about their barriers to healthcare, but really what we will focus on is our eligibility for healthcare, specifically the Affordable Care Act, challenges and promising practices to help H2A workers enroll in health insurance through the Affordable Care Act. I will be sharing a video that was created by colleagues in North Carolina to educate H2A workers about the Affordable Care Act. And then we are going to switch gears quickly and talk about COVID-19 and H2A workers before we conclude with resources. Next slide, please. So before we go into the healthcare issues, I do just want to share really briefly who are H2A workers. And my colleagues a couple of weeks ago did a deep dive into H2A workers and the H2A program. But it's important to know who they are so we understand what the barriers to healthcare access are. So generally, there are approximately 2.4 million farm workers in the United States, and this is an estimate. But in terms of H2A workers, there are 317,000 certified H2A positions in the United States in 2021. And we say certified because employers have to apply to the US Department of Labor in order to bring H2A workers into the United States. So this number comes from the US Department of Labor, and it was the total number of positions that the Department of Labor approved for H2A workers in 2021. So, and many of those certified H2A positions are filled. So the program continues to grow, and that is why it's important to really focus on H2A workers and their healthcare access. Next slide, please. So who are H2A workers? H2A workers are predominantly from Mexico, although there are a growing number from Central America. And that's important because these workers from Central America, and actually workers from Mexico as well, are coming increasingly from indigenous communities. So their primary language may not be Spanish. Their primary language may be indigenous languages, Mixteco, Quiche, Hmong, and others. So when thinking about the barriers to healthcare, it's important to understand their language barriers specifically. Many are young men between the ages of 18 and 35, meaning that these workers are young and healthy, and so they may not see a need to have health insurance or to access healthcare while in the United States. So these are just important pieces to keep in mind as we talk about their healthcare and how to promote healthcare access to H2A workers. Next slide, please. So before we talk about H2A workers and their eligibility for healthcare in the United States, I do want to talk about the barriers that they may encounter when accessing healthcare in the US. We talked about language. Many come from Mexico, so they may be most comfortable in Spanish. And while there are many areas of the country where there is Spanish language services available, it may not always be available in their areas. There may be limited interpretation services at the clinics, depending on where they are. But then especially for those workers who speak indigenous languages, finding that interpretation can be extremely difficult. And that is an additional barrier to their healthcare access. There is, of course, a lack of access to clinics. And in the next webinar in this series, we will talk more about strategies to promote outreach to H-2A workers. But what I want to highlight is that H-2A workers live in employer-provided housing. So they tend to be more isolated from the community than the general farm worker population. And they also rely on their employer for transportation. So they don't have their own transportation into town. They rely on their employer. And therefore, they may not be able to easily access clinics or other resources in their communities. And that is why outreach to the workers is so important. Another really important barrier is lack of sick leave. And for those of you who work with farm workers, you know that very few farm workers actually have access to sick leave. And H-2A workers, especially because of their visa status, and because their stay in the US is dependent on their employer, they may be reluctant to take time off if they are not feeling well. They may be reluctant to report any injuries at work or any illness outside of work. And they are here to work, so they want to make money. And so because they don't have sick leave, it's really hard to motivate them to access healthcare. And of course, fearing employer retaliation if they do get sick, does that mean that their visa will be terminated and they'll have to return to their home country? The US healthcare system, of course, is extremely complicated and extremely confusing, and there's not a lot of information about it. So it can be hard to navigate. Lack of health insurance, which we'll talk more about when we talk about the Affordable Care Act and opportunities for health insurance. And then, of course, follow-up treatment, because these workers are only in the US for a short period of time, usually up to 10 months. So if they have any issues that require follow-up care, especially when they return home, that continuity of care is extremely challenging, because they don't have that continuity from the US to their home country. Or for workers who work with farm labor contractors, if they go from area to area, they may not have that continuity of care from one area to another area, even within the United States. Next slide, please. So I want to, before we go into the health access for H-2A workers, I want to launch a poll. So the question is, what healthcare services are H-2A workers not eligible for? And the options are Medicaid, emergency Medicaid, employer-provided health insurance, ACA health insurance, health centers, or none of the above. So I encourage you to put in your response. And Sylvia, feel free to close the poll when we have a number of people who responded. So it seems like most people responded Medicaid. A few responded employer-provided health insurance, and a few provided none of the above. So let's actually see what the answer is. Next slide, please. So next, it's an animated slide. Perfect. So H-2A workers are not eligible for Medicaid. So that is correct. Next. But they are eligible for emergency Medicaid, for employer-provided health insurance, for health centers, and for ACA insurance. Now, emergency Medicaid, it's important to note that it really depends on the state requirements of emergency Medicaid. So emergency Medicaid, it doesn't have the same immigration eligibility requirements as full scope Medicaid, but there are other requirements that your state may have. But generally, H-2A workers are eligible for emergency Medicaid. For employer-provided health insurance, very few employers, as many of you are aware, offer health insurance to their agricultural workers. But If the employer does offer health insurance, then H-2A workers are eligible for that health insurance. If the employer provides or offers health insurance to their workers, the H-2A worker will very likely not be eligible for financial assistance in the ACA marketplace. And that is because the ACA marketplace is really for those who don't have affordable coverage, either through their employer or don't have coverage at all due to a variety of circumstances. There is an employer mandate in place. However, there are a lot of exceptions, and especially when it comes to agriculture, the exceptions make it so that there are cases where even if you work for a large agricultural employer, that employer may not be required to offer health insurance to their workers. Health centers and are always available, and I'm going to do a quick note about health centers, and then of course ACA insurance. Next slide, please. So that quick note about health centers. Hopefully all of you know about the availability of community health centers and the healthcare that they provide. Everyone is eligible for care at a health center, regardless of their health insurance status or their immigration status. And so they have what they call a sliding fee discount schedule, and it varies from clinic to clinic. But anyone who seeks care at a health center, if they don't have health insurance, the amount that they pay for care will depend on their income and household size. And so it's affordable and it is there for everyone. So we certainly encourage everyone to access health centers in their area. Next slide, please. Next slide, please. So let's talk about the Affordable Care Act. And I see that there are already a couple comments in the chat about the Affordable Care Act. And it's actually auspicious that we are talking today, because today is actually the 12th anniversary of the Affordable Care Act. So 12 years ago today, President Obama signed into law the Affordable Care Act. So it's great that we're talking about it today. So are H-2A workers eligible for health insurance under the Affordable Care Act? Absolutely, yes. They're eligible to apply for health insurance. They're eligible for financial assistance to lower the cost of health insurance. And even though there's no longer a federal mandate, so when the ACA was first implemented, there was a mandate which said that if you didn't have health insurance, you had to pay a tax penalty. That mandate was zeroed out under the Trump administration. However, a few states do still have an individual mandate. So you do have to check with your state. The states that still have a mandate are California, Massachusetts, New Jersey, Vermont, and Rhode Island. So when you file your state taxes, they do ask about your health insurance status. And there may be a tax penalty for not having health insurance in those states. Next slide, please. But the reason why the Affordable Care Act is such a great option for H-2A workers is because H-2A workers eligible for financial assistance in the form of tax credits and cost sharing reductions. Tax credits lower the premiums, cost sharing reductions lower copays and deductibles, and they're eligible for financial assistance below 100% of the federal poverty level. And that is because H-2A workers are not eligible for Medicaid due to their immigration status. So because they are not eligible for Medicaid, they are eligible for financial assistance starting at 0% of the federal poverty level. And so 100%, just so you know, of the federal poverty level is $13,950 for an individual in 2022. So that is 100%. But again, H-2A workers are eligible for financial assistance below that amount. And generally, H-2A workers are able to have very substantial tax credits and financial assistance. They are only eligible while they're in the United States. So they're eligible when they enter the United States to enroll in health insurance, but they must disenroll before leaving the United States, because once they leave the United States, they no longer have an eligible immigration status, and so they are no longer eligible for the Affordable Care Act insurance. And I do see questions in the chat, and I will get to those shortly. So let's continue for the moment. Next slide, please. So many workers do arrive outside of open enrollment, as we know. So open enrollment is generally from November 1st to January 15th every year. Now, for workers who arrive outside of open enrollment, there is what's called special enrollment periods. And so there are certain events that can be triggered in order to qualify for a special enrollment period. And for most events, you have 60 days to apply and enroll in health insurance. For H-2A workers, this special enrollment period is triggered when they enter the United States. So when they enter the United States, they have 60 days to apply and enroll in health insurance. Next slide, please. So here's an important piece. Workers who enroll in health insurance must file taxes. That is because when they receive tax credits, they need to reconcile those tax credits on their tax returns. The information that they provide in their health insurance application should be the same as the information that they provide in their tax returns. Many H-2A workers do file tax returns, and H-2A workers may claim dependents on their tax returns, depending on their eligibility under the IRS codes. And so those dependents can also be included in their health insurance application as part of their household size. That's important because H-2A workers, because the tax credits are based on your federal poverty level, if you have a larger household size and a low income, you're at a lower federal poverty level, and therefore you qualify for more substantial financial assistance. So it's important that whatever they put into the health insurance application reflects what they put into their tax returns and versa. Next slide, please. So in order for workers to enroll in health insurance, they should have a few documents with them. They need their H-2A visa. They need their arrival departure card, their I-94, any recent pay stubs or their W-2 from last year. You can also often connect to the IRS portal. So if the worker filed tax returns last year, then they can access that. But it's important that the income that they put into their application is reflective of the income that they will have in that year, because when they file their tax returns the following year, that may, if they're making more or less, that will change what they owe or what they may get back from the government based on the tax credits. So it's important that they try to estimate as much as they can what their income, as close as they can, what their income will be. They also should have the name and address of their employer. Now, they don't need documentation for the employer, But especially because H-2A workers live in employer-provided housing, and because if your employer offers health insurance, you don't qualify for tax credits, they do ask for information about your employer when you're enrolling in health insurance. Next slide, please. Okay, let's stop there. I see that there are questions in the chat. So I am going to try to go back, but Paige, do you want to help facilitate some of the and moderate some of the questions that have come in?
Sure. So I think the first one was, how does the ACA Financial Assistance work? I think you mostly answered that, but if there's anything you want to add.
So there are the tax credits and cost sharing reductions. So the cost sharing reductions are only for the plans that are on the silver level. So there are different metal tiers within the Affordable Care Act. If you decide to enroll in a silver plan and you have a federal poverty level below 250%, then you can qualify for cost sharing reductions, which basically lowers the copays and the premiums. For the tax credits, usually what happens is they usually apply the tax credit directly to the premium. And so if you enroll in a plan and the premium without tax credits is $500 a month, and you qualify for a $400 a month tax credit, then typically they apply that directly to the premium. So then instead of paying $500 a month, you only pay $100 a month for that health insurance. So that's, and then all of that is reconciled when you file your taxes.
Great. Okay, so this is a really good question. What are the advantages of farm workers enrolling in ACA versus just receiving, fee-based care at the health centers?
That's a great question. So health centers are fantastic, and health centers actually do accept health insurance. For the reason why I think a worker would want to consider having comprehensive health insurance as opposed to going to a health center is that even though, and actually the video that we're going to show is going to talk about this a little bit, but even though health centers have that sliding fee discount schedule, health centers really only provide primary health care. And if there is an accident, or if a worker gets sick, or if they need additional treatment, having that comprehensive health insurance is really important, because then ultimately they'll pay a lot less for their medical care.
All right, so then the next question, I think you answered most of this, but I'll give you an opportunity to expand on it. So what happens with agricultural workers who spend half of the year here in the US and half of the year in their home countries? Can they apply for the PTCs through the marketplace for only 6 months? And then you said, do they have to file taxes to reconcile their tax credits? But then what happens if they miss the tax season?
So when you enroll in health insurance, you enroll, and it's basically for, it's technically for a year, but when you enroll, you can cancel health insurance at any time. Any of us can cancel health insurance at any time. So workers, because they qualify for the Affordable Care Act, because they have an eligible immigration status. But when H-2A workers leave the US, they no longer have a status because their visa is expired. And so, they no longer have an eligible immigration status. So they don't qualify for the ACA, nor do they qualify for tax credits once they leave the United States and once their visa is done. So they need to disenroll, and then they would just pay for the amount that they use to health insurance. They still have to reconcile their taxes and their tax credits. So they do have to file taxes. And taxes and H-2A workers is extremely complicated. And there are individuals who do specialize in taxes for H-2A workers. And I would certainly encourage, and I know we have some legal services folks on the line, I certainly would encourage those who are working with H-2A workers to connect with legal services. They can help you connect with tax specialists who can help the H-2A workers file their taxes appropriately.
All right, and then the last question, in order to be included in the ACA coverage and tax returns, do their dependents have to be in the US at the same time as the workers are? Can they live back in their home countries?
So the IRS has definitions around dependent. So they don't have to live in the US actually to be included in your household size. They do have to meet the IRS definitions of dependent. And there are certain definitions, and that includes residents of Canada and Mexico. So Mexican H-2A workers, depending on how they decide to file their taxes, can, if they meet the definitions of dependents under the IRS, they can include those dependents as part of their household size when they file their taxes. But again, I would encourage them to talk to tax experts and others so that they accurately include the dependents, or that they fill out their tax returns in a way that is best for them within the means of the law. And I am not a tax expert, so.
Oh, Vanessa said, I have encountered issues on the marketplace when dependents don't have a social security number. I also have, Vanessa.
Yes.
I'm with you there.
Yes, and that happens. So some H-2A workers do have social security numbers. And if they do have social security numbers, they should absolutely bring them with them when they enroll in the marketplace. However, a social security number is not required. It does, however, mean that you may have some matching issues with the health center or with healthcare.gov or when trying to enroll because you don't have that social security number. But you should be able to get through the system eventually. It may take some phone calls, it may take some extra time, but that is why having that visa and having that arrival departure card is important, because that does allow you to put in a valid immigration status. And hopefully that surpasses the need to put in a social security number. But this is why there are a lot of challenges around enrollment, which we will talk about. And so actually, I think that's a great segue to our next portion of the presentation, which is health insurance enrollment. So it seems like a few of you have, but the poll question that I would like to ask is, have any of you helped enroll H-2A workers in ACA insurance? And Ninel, you point out that workers have a hard time finding someone who can help them with their taxes and are knowledgeable about the H-2A program. And that is absolutely a challenge. And there are very few tax experts who are knowledgeable about the H-2A program. So that's a real challenge. And so it looks like most of you have not. So this is, so hopefully this information that I'm about to share, if you have not enrolled H-2A workers, but maybe thinking about it, maybe this can help help you think about some of the challenges you may encounter and some promising practices. Next slide, please. So enrollment in the ACA is a process. And there are a lot of challenges that one may encounter when trying to enroll H-2A workers into ACA health insurance. So I'm going to talk about it in 3 stages: pre-enrollment, enrollment, and post-enrollment. So pre-enrollment, one of the major challenges is talking about why workers may need comprehensive health insurance. H-2A workers receive workers' compensation insurance, regardless of what the state laws are about workers' compensation in their state. In some states, farm workers may not be eligible for workers' compensation, but as part of the H-2A program, all employers must provide workers' compensation insurance to their H-2A workers. Workers' compensation insurance, of course, only covers injuries and illnesses related to their work. Now, the challenge is that H-2A workers are here to work. And so they may not see a reason to have health insurance when they have workers' compensation insurance. And actually the video that we're going to show really tries to kind of show why a worker may want comprehensive health insurance as opposed to just workers' compensation insurance. But having that discussion and talking about the differences and compelling them to understand the advantages of comprehensive health insurance can be a challenge. Of course, there still is 12 years later, a lack of knowledge about the Affordable Care Act. Many workers may still not be aware of its existence, and they may not be aware of their eligibility and how they can enroll. Another challenge that I want to point out is I mentioned that H-2A workers who come to the US outside of open enrollment are eligible for a 60-day special enrollment period. And I also mentioned that this special enrollment period begins when they arrive in the United States. They cannot enroll until they are physically in the United States. And the challenge is that workers may not get to their farm until 10 days after they arrive or 5 days after they arrive. And then you only have a limited number of days, a limited number of assisters, and a lot of people who come all at once who all have that same enrollment window. So it can be hard to get all of those enrolled who want to enroll within that time frame. Next slide, please. And then you have the actual enrollment process. And as has been pointed out, the enrollment process can be quite challenging. We really think that in-person assistance is the best way to enroll H-2A workers. I don't know how many of you have tried to enroll yourselves using the call center or using the ACA Marketplace websites, but it can be quite challenging. And it's not really conducive for those who may not be familiar with the US healthcare system, with the different kind of health insurance plans, with technology. It's just a lot to kind of deal with. But there is not always adequate in-person assistance to support enrollment. So that's a big challenge, making sure that there are enough in-person assisters to help those workers who want to get enrolled. And then it takes time to enroll. It's not a quick process. It can take an hour. It can take multiple hours, depending on kind of what you encounter on the websites, on the call center, talking through the different plans, the advantages, what may be best for that worker. So it can take a lot of time, and that's time that you have to dedicate and time that the worker has to dedicate. Next slide, please. And then, of course, there's post-enrollment. So the worker enrolls in health insurance. Great. Okay, how do they pay their premiums? So some workers may not have a premium at all. They might enroll in a plan where they don't have a premium. Their tax credits are substantial enough that they don't pay a premium. But many will likely pay some premium, maybe $10, maybe $20, depending on where they live and what plan they enroll in. How do they pay those premiums? That is really something that is part of the education, and showing them how they can pay their premiums using a money order or however they may want to pay the premium. And then, of course, they want to find a primary care provider. So, of course, it's best to be within your health insurance network. So helping those workers navigate the complicated US healthcare system and find a primary care provider in the area can take some time. And then disenrollment. So as I said, they need to disenroll before they leave the United States. And sometimes it's just a phone call, really easy, but they also might need help with that. And so these are all challenges that need to be considered. And, it can take hours and hours. It has to be consistent because it's a constant process to help H-2A workers and ensure that they not only enroll in health insurance, but that they can utilize that health insurance once they enroll. Next slide, please. So with all these challenges, why should we even bother to enroll H-2A workers? What works? And I will say that there are a lot of promising practices out there. And since the ACA has gone into effect, many H-2A workers have successfully enrolled in health insurance, despite all the challenges that they may encounter. One of the best promising practices, and I'm sure this is no surprise to any of you, is partnerships. Partnering with local organizations, partnering with the consulate, partnering with employers. And that is because those partnerships can help to ensure that workers are educated about the Affordable Care Act and health insurance options before they enter the United States, upon arrival in the United States, and they can help provide access to workers so that workers are able to take time to enroll in health insurance and then to be able to do what they need to do to utilize that health insurance. The other promising practice that I want to point out is sustained on-site in-person assistance. And this is because, as you've seen, there are a lot of stages to enrollment. There's pre-enrollment, there's enrollment, there's post-enrollment. And so there has to be assistance along the way. And it requires a lot of time on the part of the outreach worker and the assister to build that trust and to ensure that the worker has all the information they need in order to be able to enroll in health insurance. And so that intensive follow-up is really important. And it really does help create this trust that allows the worker to comfortably enroll in health insurance and then use their health insurance after they enroll. So those are the promising practices that I wanted to highlight. And so the next slide, please. I want to share a video, and this video was created by colleagues in North Carolina. It was created in 2015, and this video is called Dos Opciones, Un Camino. It features outreach workers and farm workers, and the video itself, and I'll share my screen, so I will share the video. The video itself is really an opportunity to educate workers on the importance of health insurance and why they would want to enroll. So I am going to share my screen. And hopefully this will work. Can everyone hear it?
Dos opciones, un camino, dos opciones las que tiene mi esposo, mi amor. Dos opciones, un camino, dos opciones las que tiene mi esposo, mi amor.
Gracias por estar aquí con nosotros durante su día libre. El día de hoy les traemos información acerca de la Ley de Cuidado de Salud a Bajo Precio, también conocida como Obamacare. Esta ley requiere que casi todas las personas en Estados Unidos tengan un plan médico. Y si no lo tienen, tal vez tendrán que pagar una multa bastante alta. Además, tener un plan médico es importante porque nos ayuda a ahorrar dinero. En este país, las personas sin un plan médico deben pagar mucho por cualquier tratamiento médico. Si están pensando que tener un plan médico es muy caro, no se preocupen porque el gobierno ofrece ayuda para pagarlo. Entonces, ustedes tienen dos opciones: inscribirse a un plan médico o no hacer nada. Pero recuerden que una enfermedad inesperada o un accidente le puede pasar a cualquiera. ¿Tienen alguna pregunta?
Cuidado, hombre.
Por ejemplo,
Plan médico. ¿Para qué? Esas son cosas para viejitos. Nosotros somos jóvenes y fuertes, ¿ah? No más.
¿Te imaginas?
Y dígame, ¿cuándo yo en mi vida he tenido un accidente? ¿Nunca? Sí, yo tampoco.
Si no te inscribes, a lo mejor te
Oigan, muchachos, ¿qué les parece? Nos vamos de aquí a echarnos un partidito.
tendrías que pagar una multa bastante.
¿A mí? Vamos, a disfrutar un ratito. Mira, eso, mira, tuya, pa. ¡Número uno! ¡Nadie lo puede parar! ¡Ni tú! ¡Ni tú! ¡Ni tú! ¡Qué golazo! ¡Vamos, vamos! ¡Izquierda! ¡No lo sé!
¡Wow! ¡Oh, wow! ¡Ay! Creo que me rompí el tobillo.
No puede ser. ¿Qué vamos a hacer? Mira nomás cómo se te puso el tobillo. Johnny necesita ir al médico.
Sí. ¡Ay, qué dolor! Y mañana tengo que trabajar.
Espera, Johnny, no te muevas. Tenemos que llevarlo al hospital. Sí, pero tú sabes que eso cuesta bastante dinero. Johnny no tiene un plan médico. Pero es su pierna. Tenemos que hacer algo. Johnny, ¿estás seguro que no puedes caminar? Hermano, que si ya no vuelves a caminar nunca.
¿Cómo dices esas cosas? Cállate y ayúdame a parar.
Disculpa, vamos. Ayuda, agárralo.
Buenas tardes, señor Johnny. Siento dar malas noticias, pero su X rayo mostrar tobillo roto. Varias partes. Mala suerte, necesitar cirugía ahora, este momento entender, señor Johnny.
¿Qué? ¿Cirugía? ¿Ahora?
Sí, sentirlo mucho, pero cirugía no poder esperar y si no hacer ahora, ponerse peor. Y después de cirugía, necesitar terapia. Varios meses, terapia. Entender.
Sí, supongo, si no hay otra opción.
No preocuparse. Operamos su tobillo para usted poder caminar otra vez. Pero todo será muy caro. Espero usted tener seguro médico.
No.
Cirugía costar $20,000, $5,000 terapia física, $4,000 anestesia, $800.
No. Espere. No, espere, no. Señorita, ¿puedo escribirme en un plan médico lo más pronto posible? ¿Puede ser ahora mismo?
Qué bueno que hayas decidido inscribirte en un plan médico.
Sí, señorita. Creo que es la mejor opción para mí.
En los Estados Unidos, los servicios médicos son muy caros. Por ejemplo, si tu pesadilla hubiera sido real, habrías tenido que pagar alrededor de $40,000. Te hubiera costado un ojo de la cara. ¿Te imaginas? Los trabajadores H2A como tú tienen 60 días desde el día que llegan a los Estados Unidos para inscribirse. Si no te inscribes, a lo mejor tendrías que pagar una multa bastante alta.
Creo que entonces solo hay una opción correcta. O sea, uno nunca sabe lo que puede pasar.
Definitivamente has escogido el camino correcto.
Dos opciones, un camino, ahorro dinero y me siento por Dios bendecido. Dos opciones, un camino, la otra es que no pago multa por no tener un seguro. Dime, mi Dios, ¿qué más pido yo? Cuidados preventivos.
Hola, tesorito.
¿Cómo estás, mi rey? ¿Qué me cuentas de nuevo?
Tuve una pesadilla horrible, mi amor. Soñé que tuve un accidente.
Ay, mi rey, ¿qué haría yo si te pasara algo y tan lejos de ti?
No te preocupes, mi vida. Ya tengo un seguro médico, ya estoy protegido.
Johnny. Johnnycito, mi amor. ¿Qué te pasó? ¿Te caíste? ¿Te lastimaste?
Me caí, mi reina, pero no me lastimé.
Ay, mi amor, casi me matas del susto. Por poco me da un ataque. Qué torpe eres, mi Johnny.
Qué pena, mi vida, pero no te preocupes, ya estoy protegido. Te extraño, mi amor.
Yo también te extraño, mi amor. Cuídate bien hasta que regreses aquí conmigo, mi rey.
Vamos a seguir, tú y yo, nos vamos a ver, y bailamos como siempre.
Recuerde que tal vez sea obligatorio que usted se inscriba en un plan médico. Infórmese acerca de sus opciones para que pueda escoger el mejor camino.
So, any reactions to the video?
There's lots of love it comments in the chat.
Yes, it's really great, and it's really interactive. It talks about why workers may want to be enrolled in health insurance, the advantages, and also it features workers themselves, which is really great, and talks to the concerns that workers have. And so it's just a really great educational video. The only piece that is out of date, of course, is the fact that they may have to pay a penalty. That, of course, is no longer the case, but I think generally the messages still really resonate. So we will certainly share the link in the chat. And I think we can go back to the PowerPoint. So before we conclude, I just want to touch really quickly on COVID-19 because we are still very much in pandemic. So of course, all of you know that H2A workers are extremely vulnerable to COVID-19. They live in crowded and inadequate housing. They take crowded transportation, not only from their home countries to the United States, to the farms where they work and live, but also because they're relying on their employer for transportation, they tend to be crowded with other workers, either going to the fields from their housing or going into town. Of course, again, that lack of sick leave, that fear of employer retaliation certainly makes workers less likely to share if they're positive for COVID or to test themselves for COVID. And then access to testing and vaccines and treatment can still be a challenge, both here in the US and in Mexico and their home countries. And of course, misinformation is still rampant. Next slide, please. So many of you may have heard about the COVID vaccine requirements for those entering the United States. In January, on January 22nd, 2022, the Department of Homeland Security put forth a regulation that all non-citizen, non-legally or lawfully permanent residents entering the United States from the land border, so of course, those entering from Mexico, must be fully vaccinated from COVID-19, either with a CDC approved vaccine or a World Health Organization approved vaccine. Now, previously, essential workers, those coming to the US for essential reasons, were exempt from this requirement. But starting in January, all individuals, essential and non-essential, had to show proof of vaccination. Now, this is in effect until April 22nd or April 21st, apologies, right now. It's not clear if the Department of Homeland Security will extend this requirement beyond April 21st. but we certainly will keep you posted on any developments. The important thing to note about this requirement is there are challenges around H2A workers accessing CDC and World Health Organization approved vaccines in Mexico. Some H2A workers may only have access to CanSino or Sputnik, which are not approved vaccines by CDC or the World Health Organization. But many H2A workers who are returning to the United States likely have been vaccinated. They were likely vaccinated in 2021. So it's unclear exactly the impact that this regulation is having on the ability of H2A workers to enter the United States, but it currently is in effect. And so I wanted to highlight that. Next slide, please. And of course, the COVID vaccine is free and available to everyone, regardless of their immigration or health insurance status. And I'm sure many of you have been involved in the efforts to vaccinate H2A workers in your communities. There is free or low-cost treatment and testing for COVID also available. That really depends on your insurance status. The Health Resources and Services Administration, which is an agency within the U.S. Department of Health and Human Services, they did have a program where healthcare providers could be reimbursed for providing testing and treatment to uninsured individuals. However, that program has ended due to lack of funds. It ended yesterday, actually, March 22nd. But some states do cover COVID-19 testing and treatment for uninsured individuals. And especially under states have opted to have testing, COVID-19 testing and treatment under emergency Medicaid. So it's important to check with your state and local providers to see what options uninsured individuals have to access free COVID-19 testing and treatment. But health insurance, if you do have health insurance, should cover testing and treatment for COVID-19. Next slide, please. So before we conclude, I wanted to just see if any of you have experience promoting COVID-19 vaccination or testing or providing information to H2A workers, and if so, what that experience has been like.
Good morning, this is Liliana from Campesinos Sin Fronteras.
Hi.
So we have experience providing COVID-19 testing to farm workers, H2A workers, and local farm workers here in Somerton and San Luis, Arizona. And we usually do the outreach on the early morning, so we can provide those services at the time they are before they go to work. So we usually set up at 2 a.m. for the vaccination event, and start the event at 3 a.m. until 6 a.m. So we usually choose those hours because that's the time they either cross the border from Mexico to come to work, or that's the time the buses pick them up at their parking location. So we do that, and we have promotores going to different locations in town to give them flyers and let them know we are having that event as well.
Thank you for sharing. I know Campesinos Sin Fronteras has done a lot of work to help educate and promote COVID vaccine testing and vaccination amongst the workers in the area. Anyone else like to share anything that they have done or any promising practices? We can also move into questions that you may have.
It looks like we have three folks with their hands raised. So we have Jenna
Oh, great.
Bird, then Christian Quiroz, and then Leonel Lopez. So Jenna, do you want to start?
Sure. This is Gina Bird. I'm with Greene County Healthcare. We're in rural North Carolina.
Yep.
We cover 17 counties. And we've been active in testing from the very beginning and then started doing the vaccines as well. So currently our clinics vaccinate 5 days a week out of 2 clinics. And then our team, which is a outreach program, actually vaccinates on Thursday nights. We have a group of caseworkers that go out to the camps as soon as they arrive and see, if they've been vaccinated or up to date on their vaccinations, and then they get them an appointment with us on Thursday nights. We're also helping out with the North Carolina Farmworker Health Program. Have gone up there and tried to volunteer a little bit with them just to see kind of what their process is. And I know they're hard at work at VAS, vaccinating a lot of guys coming in from Mexico. We have worked a lot with CVMS. There has been a lot of changes as far as the documentation, which has improved tremendously. I think they've listened and their help desk has helped a lot. We did have a lot of guys coming in that we voiced our concerns because when they came to us last year, when they're in the US, a lot of times they may use only 2 names. And when they're coming across the border, of course, they're showing their passport that has all 4 names. And so there has been some issues with that, with the guys not coming across, but we work with trying to correct that. And I know the North Carolina Farm Worker Program or Farm Help Program is actually, when the guys are coming through or working through the Growers Association, are actually getting emails and putting it into the CVMS, which I think is great, because that way next year, if they have any problems with it getting across, the guys can actually enter that program and go in and actually obtain their vaccine records themselves before they cross. So that's it.
It was asked if you can repeat the problem you had with names, and I've heard that challenge as well. So do you want to just share again what the challenge was about names?
Actually, when the guys come here, a lot of times they drop several of their names just because I guess they're familiar with the culture over here with people just using a first and a last name. And so when they would go and get vaccinated, we work with the Latino population a lot. So we try to make sure that we get all their names put on their cards and actually entered into the CVMS. But with a lot of the pharmacies that maybe not work with that culture, may not realize the 4 names. And so they may put 2 names in. And then when the guys actually went back to Mexico, they had a hard time coming back across the border with the cards that they had, because it did not have the whole name that was their entire name that was listed on their passports. So we're trying to, we're trying to work through that, make sure that the guys realize to give their complete name when they get vaccinated. And we're actually going in and actually updating. When I see somebody come in, we're actually going in and updating the CVMS. And I believe the North Carolina Farm Worker Health Program is actually participating and doing that a lot at VAS, where the Growers Association is.
Thank you for sharing. Yeah, and that's also been a challenge around ACA enrollment as well. But access to vaccination information, access to cards, making sure that the names are the same. Those are many challenges that have been experienced by workers trying to enroll in health insurance or around COVID-19. I think Christian.
Hi. Hi, everyone. Hi, Alexis. How are you? So
Hi.
as a result of the National Center for Farm Worker Health grant we have received, we have disseminated information on every single outreach trip about vaccination clinics, about testing resources that the workers might have in their area. And we have in many instances facilitated vaccination clinics to happen at migrant labor camps. Also participated in health fairs to provide information to the workers about the vaccines and, disseminate any doubts that they might have and fears surrounding vaccines. So I'm pretty happy that, because of this requirement that we have this year to return the US, I think the workers will feel like we provided tremendous help in making them eligible to return to the US for the ones who had received the 2 doses. Some even received the booster before they left. So that's all I would like to share with you guys. Thank you.
Lionel.
Hello, guys. You can call me Leo. It's easier. I'm from Indiana Legal Services in Indianapolis, and yes, we also helped. Last year, we held a vaccination clinic after farm workers requested it, afraid that they wouldn't get the vaccination back home or things like that. And so we did end up vaccinating, I think it was a little bit shy of 200 workers. After that, we saw that, well, I don't know, so in Indiana, we also have a coalition called the Indiana Migrant and Seasonal Farm Worker Coalition. And this is made up of many different agencies. And so we saw that there was a need for medical assistance within the farm worker community. So now we're trying to tackle also a way to do even more COVID testing or more COVID vaccinations, or just in general health clinics. But it's something that we're trying to tackle. And then I actually did have a question with the name issue that came up with Jenna. I had an issue that came up, but it wasn't 100% with farm workers, though I imagine it crosses over to the farm worker world. But the issue was that, as we know, undocumented workers sometimes use a different name at work. So the issue that we had was that workers they got vaccinated under their actual name, their legal name, but then they were working with a different name at work. And then this was back when the vaccination mandate for a certain amount of workers for companies was around. It's not, I don't think it's mandated anymore, but at that time, they ended up, they didn't know how to show that they were vaccinated at work because they weren't using they had different aliases in real life and then at work life. And I didn't know if you guys had ever come across something like that, or what you did to fight that, I guess.
I did have one case this year like that, and unfortunately, due to the legal consequences, we could not do anything, but we could not change it to their alias name. They actually came in with their appropriate name out as it was, what their name actually was. So we could not actually change it to what they were using at work. And that was just an unfortunate thing, but we just couldn't do it because of legality. They presented themselves under one name, which was an alias name, which was their name, but we could not change it to another name.
All right. Alexis, we have, and I'm sorry, Flor, we have got to wrap up. So unfortunately, we can't take the next question. So Alexis, if you want to close us up.
Sure. Can you share your screen one more time, just so I can share some resources that we put together? So we have a lot of resources available, both, and I spent a lot of the time talking about ACA because that's kind of really the primary way for H-2A workers to access healthcare. And I think where there's a lot of confusion still. So we have fact sheets that we created. They're available in Haitian Creole, Spanish, English, Mom, and Mixteco. The Mom and Mixteco are video fact sheets, and they're on topics specific to H2A workers, as well as how to apply for health insurance, understanding health insurance, eligibility for health insurance. So all of those materials are available on our website. We also have a lot of COVID-19 resources, as does NCFH. I know we didn't talk a lot about COVID-19, but we certainly encourage you to access these resources. There are videos, comic books, activity books, photonovelas. We have a children's vaccination song. So we have a lot of different ways to share information about COVID-19. And NCFH, of course, has a lot of resources that they've created as well. So I certainly encourage you to go to their website as well. And so next slide. I just want to thank you again. I hope that the information was helpful and informative. And if you have any questions, please don't hesitate to reach out to me. Thank you, all of you, for participating, for sharing your experiences, and